Hi, my name is Jenna Joroff, and my presentation is about how adolescents are more sensitive than adults to acute behavioral and cognitive effects of THC. And I chose to talk about this because I feel like since weed is being legalized in the States and in Massachusetts specifically, the use of it has increased substantially. At least in my demographic and in my experience, I've noticed a significant increase of it. And I feel like there's just not enough studies done to see the effects that THC is having on adolescents. So when I stumbled across this study, I thought it was going to be very valuable for me to look into it and see what the data shows about how THC actually affects adolescents. So this study was posted in the American College of Neuropsychopharmacology, which is a subset of Nature. The authors include Connor H. Murray and Royce Lee, and it was published on February 2nd, 2022. Okay. So the abstract talks about how the primary risk factor for adverse drug effects might be age. Evidence states that the acute effects of THC, which is the primary constituent of cannabis, are greater in adolescents. This study aims to determine if adolescent men and women are more susceptible to acute THC compared to adults. Participants received THC capsules and a placebo across 3 sessions that were randomized and double-blinded. This means that they didn't know if they had received the placebo or the cannabis, and the researchers didn't know, so it was double-blinded. Subjective cardiovascular, behavioral, and EEG measures were obtained during each session. The behavioral measures included a simple time task, a stop task, time production, and back, and EEG measures. THC affected the subjective stature and heart rate similarly in both age groups, but adolescents were more sensitive to performance time, response accuracy, and time perception. The EEG measures conclude that THC did increase P300 amplitude in adolescents, but not in adults. Sorry for the siren. At doses that produce comparable rates of intoxication, adolescents might exhibit greater cognitive impairment and alterations in brain function. So looking at past examples of rodent studies and past evidence, they thought that investigating adolescents compared to adult use would be a very valuable study. So the introduction states that between 2002 and 2019, there has been an increase in cannabis use by adults from 7 to 15.2%. This increase can also be associated with a greater incidence of adverse effects after administration. Adolescence is one factor for the increased risk of adverse responses to cannabinoids. Your CB1R receptors are highest in adolescents, with peaking expression occurring between the age of 15 and 17, and only declining at around age 35. In past rodent studies, THC was shown to have greater locomotion effects in adolescents, and the adolescents showed greater impairments with spatial and non-spatial learning. Adolescents are also susceptible to chronic THC use, which is related to brain development and can be influenced into long-term mental problems. THC has been shown to reduce amplitudes of ERPs, which are event-related potentials, including the P300, which is an index of attention and working memory. Evidence also shows that THC alters amplitudes of neural oscillations in the resting state. EEG was used to assess the effects of THC because they hypothesized that THC would produce greater effects on P300 amplitude and in the resting state of EEG in adolescents. They compared subjective, cognitive, and EEG measures after acute oral doses of THC and placebos in healthy male and female adolescents and then in adults. They had to fit the criteria of less than 20 total lifetime uses of cannabis and no cannabis used in the last 30 days. This minimized the effects of tolerance and allowed for observation for adolescents during initial exposure of the drug. Their formal hypothesis was that adolescents would be more sensitive to THC across all measures. This study took adolescents and adults who participated in 3 5-hour sessions where they received capsules containing THC or placebo. The THC was given under double-blinded and randomized conditions. The subjects included 6 female and 6 male adolescents between the ages of 18 and 20, and 6 female and 6 male adults between the ages of 30 and 40. They had all only had used THC between 1 and 20 times in their lifetime and had not used anything in 30 days. They had also had to provide negative urine tests before each session, just to confirm that they hadn't used cannabis in the last 30 days. The drug administered was THC, and it was given in 7.5 milligram or 15 milligram doses. The placebos only contain sugar. The doses given reflect the amount of THC in 1/2 or 1/4 of a typical joint. So they were really measuring to see a typical dose of THC. And that's something that's really debated right now, is because we don't have a formal way of measuring dosage in cannabis, and it's all subjective, and there's not one quantity for one hit. So they were just measuring how much would be in a typical joint that one person would typically consume. Moods and subjective drug effects were assessed during the sessions at regular intervals. They answered the drug effects questionnaire, which asks 5 questions assessing the drug effects. They then answered the Addiction Research Center inventory, which asked 53 true or false questions measuring typical drug effects. Their blood pressure and heart rates were also monitored at regular intervals. Between 100 and 150 minutes after administration, the participants performed 4 behavioral tasks: the simple time task, the stop task, the time production task, and the end back task. The simple time reaction task measures attention. They are instructed to press a key as quickly as possible to a target on a computer screen. The researchers then compared the difference between the mean and modal time. The stop task assessed their ability to inhibit the prepotent motor response. The primary measure was for accuracy and the proportion of correct responses on this trial without stop signals. The time production test assessed their ability to assess time. They had to hold a key for 20, 30, 40, and 50 seconds in a random order with a distracting stimulus present. The end-back task assesses executive attention and working memory. They had to respond to a current visual or audio stimulus and state if they had previously seen or heard it 2, 3, or 4 trials earlier. The EEG data were collected first to see their resting state. So participants' EEG data was recorded while they rested comfortably with their eyes closed for 5 minutes in a comfortable position. They then participated in an auditory oddball test where they pushed a key if they had heard a certain sound or pushed another key if they didn't. So based on the subjective ratings, dose-dependently increased ratings on several measures. On cardiovascular measures, THC dose-dependently increased heart rate in both groups. THC did not significantly affect blood pressure for either group. Behaviorally, both groups did not differ in the absence of the drug. THC dose-dependently increased lapses in attention during the simple RT task in adolescents, but not in adults. Drug decreased accuracy in adolescents, but not in adults. Adolescents also showed poorer accuracy than the adults regardless of the drug. THC dose-dependently reduced P300 amplitudes for adolescents, but not adults. The adolescent group showed significantly lower oscillatory power relative to adults. At the end of the session questionnaires, groups correctly guessed if they had received the placebo on their sessions. After 7.5 milligrams of THC, 75% of the adolescents guessed correctly compared to 25% of adults. So 3/4 of the time, the adults were not sure if they had received the placebo or the THC, which I find so interesting compared to 75% of adolescents knowing and only 1/4 no. I feel like there has to be some sort of correlation between that, because I feel like THC consumption should be pretty clear if you've ingested THC. And the fact that almost 3/4 of them didn't know and couldn't guess correctly is it's very interesting to me. So the goal of this experiment was to see if healthy adults were more sensitive to oral THC than adults were. Compared to adults, adolescents exhibited stronger effects of the drug on measures of psychomotor impairment and EEG. The groups did not differ on cardiovascular or subjective impairment. This finding is consistent in both preclinical and human studies. In rodents, THC produced greater impairment in spatial and non-spatial learning and greater cognitive deficits in adolescents compared to adults. So some limitations of the study: the sample size was quite modest and cannot sufficiently examine the differences between sexes. Also, only measuring six adults compared to 6 adolescents, it doesn't give you enough of a sample size to actually determine if what you're observing is true versus luck based on a small sample size. Females were also tested at any stage of the menstrual cycle, and variations in the cycle could obscure results. And it has been found that THC affects women differently at different stages of the menstrual cycle, which I also looked into, and I find that super interesting. Adolescents are somewhat more accurate than adults in identifying THC as cannabis at the end of the experiment, compared to adults who have lesser abilities to identify which drug they received. And the range of doses was quite small, so only 7.5 and 15 milligrams were tested. And there were high restrictions on the demographics. So they had to be educated, not used a certain amount in their life, certain age groups. So it was pretty restricted on who could participate. Overall, the findings of this experiment indicate that adolescents are more sensitive to adults to the effects of THC on cognitive performance and on measures of neural function, but not to cardiovascular effects or subjective measures. These findings raise questions about the relative risk for adolescents. Compared to adults, they might exhibit greater behavioral or neural impairment doses at similar feelings of intoxication. And here are my citations. This is a citation for the article. I think that there needs to be more studies looked into the effects of THC on adolescents and really determine if there are risks and negative effects of using THC while your brain is still developing. And I feel like there has to be, because many other drugs like alcohol and like stimulant drugs have been tested and seen that they do have adverse effects when taken during brain development. So I feel like now that THC, marijuana, is legal, there's going to be more studies, especially when it becomes taken off of a Schedule I drug, more studies to see if THC actually has significant adverse effects. And then this will translate into how strict regulations are. And I know they're already strict, but there's still ways to get it as you're a kid. And if they prove that there are really strong adverse effects, which this study started to prove, there will be even stricter regulations. And I think that's just interesting because the demographics right now, especially as a college student, a lot of people are smoking marijuana. And I think people justify in their brain that this is a safe drug and it's just not addictive and whatever. But I don't think we know enough to really claim that. And more studies definitely need to be done. So I think this was a really interesting article, and I'm definitely going to research more into THC and marijuana use and learn more. So thank you. I hope you enjoyed. And if you have any questions, feel free to Slack me or email me. Yeah.